I'm Sheena Larson, and I have a bovine stifle joint in front of me, and I'm going to go over some of the anatomy of a stifle. Starting off, this here is the femur, and this is the tibia. They're both long bones, and long bones are primarily composed of a long central shaft, or diaphysis, and an extended end part, or epiphysis. In the center of the epiphysis here is the epiphyseal plate, also known as the growth plate. It is a thin layer of cartilage where the growth of long bones occur. The epiphysis is made out of spongy or cancellous bone. It's called spongy because it looks spongy to the naked eye. The outer part is cortex or compact bone. You can see that clearly here. The inner part of the bone is the medulla. It is where bone marrow is stored. There are two types of bone marrow. There is red bone marrow, which forms blood cells, and yellow bone marrow, which is primarily fat or adipose tissue. To provide blood to the bone marrow, long bones have something called a nutrient foramen. I don't have one on here. It's not long enough. They are usually located mid-diaphysis, but they are small holes which allow blood vessels to pass through the cortex into the medulla to provide blood. It is important as the source of nutrients, and it's important for bone development and regeneration. Then the outer part of the bone is covered by a fibrous membrane called periosteum, the outer part of the bone. The inner cavity is also covered by a fibrous membrane called endosteum. Now I'm going to go over some of the anatomy of the joint itself. I'm going to start off with the joint capsule, which is a membrane that encloses the ends of the bones in synovial joints. It is made out of an outer fibrous membrane and an inner synovial membrane. The synovial membrane, shown here, secretes a viscous fluid called synovial fluid, which lubricates the joint surfaces. The joint surfaces, also called articular surfaces, are covered in a thin layer of hyaline cartilage, and they form a smooth layer over the joint, which decrease friction and allow free joint movement. Hyaline cartilage is a bluish, translucent cartilage made up of densely packed collagen fibers. In between the femur and the tibia are two menisci. A meniscus is a concave, half-moon shaped cartilaginous structure that acts as a shock absorber, and it helps to support the condyles of the femur. Here's the exterior of the stifle joint. I'm going to start on the caudal aspect. On the caudal aspect of the distal end of the femur are the condyles. They are articular surfaces. This here is the lateral condyle, and this is the medial condyle. On the cranial aspect, this here is the patella, also known as the kneecap. It is the largest sesamoid bone. It rides in the trochlear groove on the femur, which is located on the distal end of the femur on the cranial aspect. It just sits right in here. On the sides of the femur are non-articular protrusions called epicondyles. This is the lateral epicondyle, and this is the medial epicondyle. On the cranial aspect of the proximal end of the tibia is a longitudinal crest called the tibial crest. There's a small bump at the proximal end of the tibia on the cranial aspect where the patellar ligament connects, called the tibial tuberosity. On the lateral side of the tibia is what in bovine don't have a full fibula, so this is just a remnant, but this here is what makes up the fibula in bovine. It is basically just the head. Now I'm going to go over some important ligaments. Ligaments bind bone to bone. I'm going to start off with the cruciate ligaments, which are located inside of the joint. So if I open it up, cruciate ligaments are named for their attachment site to the tibia. So this is the cranial cruciate ligament, and this is the caudal cruciate ligament. The cruciate ligaments bind the distal end of the femur to the proximal end of the tibia. On the outside are the collateral ligaments. This is the lateral collateral ligament. It is located on the lateral side. It binds the distal end of the femur to the proximal end of the fibula. On the medial side is the medial collateral ligament. It binds the proximal end of the femur to the distal end of the femur to the proximal end of the tibia. On the cranial aspect is the patellar ligament. It binds the distal end of the patella to the proximal end of the tibia. To diagnose a ruptured cranial cruciate ligament, veterinarians will commonly perform what is called a drawer test. A drawer test is where the veterinarian stabilizes the femur with one hand and manipulates the tibia with the other. If the tibia moves forward, like a drawer being opened, then the cranial cruciate ligament is ruptured. In animals, they have a different term for the cruciate ligaments than in people because of how they are oriented. In humans, the cranial cruciate ligament is known as the anterior cruciate ligament. And the caudal cruciate ligament is the posterior cruciate ligament. They're named differently because humans are bipedal and we stand upright, whereas many animals are quadrupeds. That means that we stand differently and many of the directional terms are different. In humans, posterior takes the place of dorsal, which is towards the back, and anterior takes the place of ventral, which is towards the belly. This doesn't work for animals, and animals have different terms for their limbs. In animals, we use the term cranial for towards the head, and caudal, which is towards the tail.